Thank you so much for inviting us, and thank you for having Maldives as the theme country this year. I'm sure it will help us highlight the work that we do, and also it's a great opportunity for our educators as well to see what can be done further in their own capacity as well. I would like to go forward with my presentation, which is the landscape of type 1 diabetes in Maldives. Let me. Maldives is geographically distributed between several different atolls, and within these atolls, we have several different islands. But the health industry, the major tertiary hospitals, they were for the most part located in the capital area, which is the central area. If you can see from my map, it's the Malha region. You can see this is actually the number of type 1 patients living in these islands. Malha area, we have 90. And if you can see in the other atolls, these are basically the atolls. Few of them have around 14, but mostly either 2 or 3. So it's very challenging for us to provide the necessary diabetes care and do the follow-up consultations for those living in the remote islands. The travel is difficult because of the weather and, of course, the affordability issues as well. So that was one of the reasons initially for us to train the diabetes educators in the islands. Um, Looking at the type 1 population in Maldives, in our clinic, we have registered with us over 2,000 patients of both type 1 and type 2 patients. But type 1, we have more than 200 registered with us. I can confidently say this is more than 95% of the type 1 population living in Maldives. Because we don't have a national register, it's difficult for me to say that these are all, but there may be few, but for the most part, these are all, almost all the patients living in Maldives. So we have, this is the age at which they were diagnosed, and then when they registered with us. So we see a peak at around 6 to 10 years, and then at 11 to 15 years. The male and female distribution is females are slightly more than males. Um, this is a chronological order of when they were registered. Most of the patients were registered with us in the year 2017. 2022 and 2023, we have around 14 and then 11 patients, 13 patients registered with us. So we saw a peak at 2017, and then we noticed that after COVID, the number of patients who are getting diagnosed have been increasing, and they are getting diagnosed at a younger age than we previously noted. So this is the distribution of the type 1 patients across Maldives, across the islands. Due to the difficulty and access in healthcare, most of them, they eventually migrate to the capital for their healthcare needs, because in the islands, some of the islands have an atoll or hospital. All of the atolls, they have atoll hospital, but then that will be in one island of the atoll. There are many islands in an atoll, and then in the other islands it will be a health center only. So they do not have the facilities, they do not have the doctors or the professionals to cater to the type 1, because Type 2 is very common. They can usually manage in the island level, but type 2 it's very niche diagnosis. So sometimes the doctor may not have seen even one patient with type 1 diabetes in the island. So we've had a lot of trouble with the doctors, sometimes change in the regimen of the insulin that we have kept for patients, sometimes changing it to mixed insulins, or even sometimes change into oral medications as well. So with that thought in mind, we actually trained a diabetes educator from each island in the Maldives, that is over 1,400 islands. So we trained a diabetes educator within the existing health system. So that means it can be either a nurse or a community health worker, so that they can act on our behalf, and we have a link with them, they have a link with us for any queries they might have regarding the treatment of those patients in the islands. And then just to have an overall supervision and see how the patients are doing. Even if we are not able to reach them, we can reach out to the educators and send them, because the islands are very small. The population may even sometimes be 300, 400 people living in the island. So we can just call up the educators and say, hey, can you see how this person is doing? We have not heard from them for some time. And if when they send reports it's very uncontrolled, we can even send them and say, can you see how they are doing, what the family situation is, how they are handling their insulin and everything. So diabetes educators play a very big part in those islands where they don't have proper facilities or proper professionals. So just a short introduction of our NGO. We are Diabetes Society of Maldives was established in the year 2000, and it became a member of the International Diabetes Federation in 2002. Our main aim is to create awareness among the public on diabetes, and to emphasize the importance of prevention of type 2 diabetes, and to help patients lead a normal life with their illness. We do a lot of advocacy work on that part in uh, usually the school environment and also the work environment for type 1 patients, to make sure that they get the same opportunities as other students in the school environment, and that they are not discriminated in the work environment because of their diagnosis. In the Diabetes Society, we have a free clinic for all patients that get registered. It was established in 2004. As I mentioned previously, we have currently over 2,000 registered patients with us, and we provide routine consultations to them. And we have in our team, we have me as a general practitioner, we have a visiting endocrinologist, dietitian as well, and then we have diabetes nurses and educators. We do regular consultations for those in the capital area. They come and they consult every month or every 3 months. And for those in the islands who are not able to travel, they send their SMBG reports, they send their HbA1c reports from the islands, or if they can travel to nearby islands to do the HbA1c. So they can send those reports to us, and we do virtual consultations for them. We collect samples. It's a very small team we have, but then for type 1s to go and sit in a queue in the general hospital to just get their sample taken, it's very difficult for them because most of them are school children. So we have established the blood sample collection, and we have signed an MOU with a tertiary hospital, so that we can send the samples to their lab and do the test from there. At each a new registration. We give diabetes education, and it's ongoing with every consultation. We provide psychosocial support, complication screening. Because of the small team, we are not able to do the screening for all the complications, but then we have again MOUs with other institutions. For example, for eye screening, we have a consultation with our eye hospital, and then for psychosocial support, further psychosocial support, we have MOU with another clinic, so the patients can get priority appointments, and they get free consultations in those places. As part of our Save a Diabetic Child project, we distribute supplies to all the type 1s who are under 26 years of age. At initial registration, they get a glucometer, and then every month they get the testing supplies enough for 1 month. So those in the islands, they will send their SMBG reports monthly, and then they will get the supplies for the next month only, so that there is an accountability aspect as well. Save a Diabetic Child project was initiated by Diabetes Society of Maldives in 2008, and it is in collaboration with Life for a Child Australia. So we are able to give, actually now we are able to give about 200 strips per month, 20 lancets, and pen needles 30 per month. We used to receive even insulin from them previously. Before DSM came into being, patients were injecting insulin from needles, via vials and needles, so it was very inconvenient for them. But then in 2005, if I'm not mistaken, we got pens, insulin pens, from disposable pens from Life for a Child, and then we switched all of our patients to pens. We have been providing insulin pens to them under this project up till 2018, which was when, with a lot of advocacy, we were able to include the pens under the National Health Insurance Scheme. Now, some of our patients are even on insulin pumps. We have around 17 patients on insulin pumps as well. Even though insulin pens are covered under the National Health Insurance, glucometers and testing strips are still not covered. CGM, sometimes they are partially covered under special license. So we have a lot of work to do in that aspect even now. Diabetes Society was the first to introduce insulin pump therapy to Maldives. The first insulin pump was donated by Czech Diabetes Society in 2013. And in 2017, we actually got 10 pumps from Dr. DAYDEIC Diabetes and Research Center. With those 10 pumps, we were able to convince the government that this is a necessary part of diabetes treatment, and we have to move with the innovations coming from different areas of the world. So we reported with these pumps, we reported how their life changed, quality of life changed, and how their glycemic control also improved. So with that, now we are able to prescribe insulin pumps to selected patients from the tertiary hospital. They can prescribe the pumps, and then we are able to provide continuous glucose continuous pump supplies to these patients under an agreement with National Social Protection Agency. Part of our work includes awareness about type 1 in school environment mostly. IDF young leaders usually take sessions for school children where Diabetes Society of Maldives usually collaborates with Ministry of Education on these matters, and we have even collaborated with them to draft a diabetes medical management plan for schools. All these years, it was missing from their medical management SOPs for schools. So after a lot of meetings, we were able to include the diabetes medical management plan within those SOPs, and we distributed glucometers to those schools who didn't have the glucometers means of testing for their students who have type 1 diabetes. Our clinical team also conducts sessions for school health officers and other relevant staff on how to manage the medical emergencies that may come up for their students with type 1. For example, hypos and hypers, how to recognize the symptoms, how to manage them, and this usually minimizes discrimination and builds an informed younger generation. What we have noticed is that the younger generation when we conduct these sessions, they are very curious, they are very open-minded once they come out of these sessions, and they look at their peers who have type 1 diabetes with empathy rather than with critique. So these sessions we try to conduct as much as possible within the capital area as well as in the islands. Whenever we go for type 2 screening programs, or uh, we we sometimes get requests from schools as well, because they have a student with type 1 diabetes. The teachers are not aware, the students are not aware, so we get requests from all over the country to conduct these sessions as well. Our diabetes educators have helped in this aspect as well. In those instances when the diabetes society team is unable to travel to these islands, we've had our diabetes educators take these sessions in the islands as well. So one of our most successful projects for type 1 patients is the Dive Maldives Youth Camp. We've had these youth camps since 2012. This is a 5-day camp. Usually the participants range from age 13 years and above. So this is the first time away from their parents, away from home for most of them. And it's a 5-day camp where they get to meet other people living with type 1 diabetes. As I showed in the map previously, one island they may have only one patient living with type 1 diabetes, and they may never have met anyone else just like them. So when they all come together and go for sessions, and we have lots of fun activities for them, it builds lifelong relationships for those, especially in the islands. We've seen that it can be very successful. Usually the activities include classes on diet, physical exercise, coping strategies. We have peer-to-peer discussions. We have motivational speakers, sometimes from other countries who are type 1, people living with type 1 diabetes who have done remarkable things in their own country. We set their treatment, we let them set treatment goals and then help them achieve that. We have sessions on mental well-being and of course networking. These are some of the pictures from our last two sessions, our last two camps. We have actually conducted a study or to see the effect of these camps on their A1C level. So we took data from the most recent 3 camps and then compared them pre-camp and 1 year post camp. So we have noted that the mean A1C of those who went to the camp actually decreased pre-camp and 1 year post-camp. Pre-camp it was at 10.25%, and then 1 year after the camp it had gone down to 9.08%. So this further shows that these camps are not just for fun, but then the information that we give out in the sessions and the connections they make help them manage their diabetes better. Due to the geographical distribution of the islands, we had a lot of difficulty sending supplies to the islands. All the islands were in lockdown. There was no travel between the islands, so patients were without insulin. They were without testing supplies. So, our Diabetes Society of Maldives, we worked with the Maldives National Defense Force to distribute insulin and testing kits to these islands as well. Again, the diabetes educators were very helpful in this aspect. They kept us updated on the status of the patients in their islands. So actually, the project 200 Islands was the name where we trained a diabetes educator in each island of the Maldives. It started in 2009, and we had a series of these trainings all across Maldives. This is an institutionalized training of 2 weeks duration with clinical and practical sessions as well. Um, their main responsibilities were overseeing the type 1s in the islands, conducting island and atoll-wide screening and awareness programs. Every year in November, we get multiple calls from our educators requesting us to help with the screening programs or awareness sessions for their community in the islands. And we have a very strong presence of diabetes educators all across the Maldives. They help strengthen the NCD clinics in health facilities all across the country. They keep registers, and they look after the diabetic patients and other non-communicable disease patients in those islands as well. We recently started a type 1 community fund project. These are some of our type 1s. Um, we recently started a type 1 community fund project. It is a 2 year project, and we provide holistic approach to type 1 diabetes care, not just consultation and giving supplies, but then also providing free mental health consultations, free screenings as well, free complication screenings. We provide if they want to go to a gym and do exercise, we provide the gym fees. And if they want to join a training academy, for example, a football training academy for the younger ones, we give their fees as well. We have introduced a lot of type 1s to CGMs this way because they were unable to afford them previously. And I'm proud to say we have over uh, around 1/4 of our patients are currently on regular CGMs now. That is about almost all the work that we do for our type 1s. But I would like to mention that not just type 1, but for type 2s as well, our educators are always on hand to help with anything they need, or to connect with us to better support their local community as well. So I would like to take this opportunity to thank our diabetes educators all across Maldives.